Are there any particular patient factors associated with inadequate hepatitis B virus suppression in HIV-HBV co-infected patients?
So it's a very interesting question. We've been using tenofovir to treat HIV and hepatitis B for quite some time, and there are a number of patients with HIV Hep B co-infection receiving tenofovir as part of a broader heart regimen. And we know that most of them become HBV DNA not detected during therapy. But there's a small subset that remains detectable over time. Now, typically the viral load is quite low. The HBV DNA is below 1,000. And importantly, they're not breaking through. So studies that have looked at, are they getting tenofovir Hep B resistance? It's not the case. They just seem to be stuck at a low level of viremia. Now, we don't fully understand why some patients may be in that particular situation. But I would start by first focusing on adherence. I've had a number of patients where they were adherent to their antiretroviral regimen enough to suppress the HIV, but perhaps not enough to suppress hepatitis B. I could think, for example, of a patient who was taking a HIV protease inhibitor boosted by ritonavir plus tenofovir emtricitabine, HIV not detected, but this individual was missing some doses, and that led the hepatitis B to be detectable. So first thing is adherence. There may also be issues related to things like renal function and liver disease stage, but at this point we don't know the significance of this low-level Hep B viremia, nor do we know if it's necessary to add a second agent, for example, adding entecavir to those patients. In my practice, I generally just monitor them without intervention.